Okay, let's talk a little bit about fair balance. Very important in continuing medical education because you don't want a promotional educational activity because it won't be accredited. Also, clinicians are pretty wise to when something's promotional and when it's just educational. So you just want to kind of stay away from any kind of promotional language. All right, so what is fair balance in CME? It means presenting all relevant treatment options objectively and without bias. It ensures CME content is free from commercial influence and aligned with educational and not promotional goals. So it may well be that the pharmaceutical company is requesting a proposal for a class of drugs for which they have a new agent, a new approval. And so they want to get the word out there about their new drug so that clinicians will start using it. But you have to also talk about the other drugs in the class that have been approved. You might should mention that agent first when you're talking about the different agents as a sort of nod to the sponsor. But really, you need to cover that to the same extent as all the agents in a certain class. And this fair balance is definitely required by accrediting bodies such as the ACCME to preserve scientific integrity and trust. And your client will definitely look for instances that aren't fair balance and will need to change those in your writing. So make sure that you provide a document that's fair balance. And then this fair balance applies to all parts of a CME activity. So slides, needs assessments, learning objectives, questions, all the things. When implementing fair balance in CME content, you do want to include, as I mentioned, all reasonable therapeutic options, not just one brand or approach. And you can list the supporter product first and definitely talk about their important clinical trial data. You want to cite peer reviewed literature and clinical guidelines rather than supporter materials like press releases, things like that. You can include non peer reviewed things like presentations at conferences, but that's about the limit of it. You want to disclose conflicts of interest for authors, planners, and faculty. That's at the program level. You don't have to worry about that when you're writing a needs assessment, but they do need to provide a conflict of interest statement. And then you want to avoid brand names unless clinically relevant, but really just try to use the generic names instead. Brand names should not appear anywhere in your documents, either your needs assessment or your final production of slides or manuscripts, whatever your final CME material is. And then, specifically with regard to needs assessments, you want to present multiple sources to describe educational gaps, trusted key opinion leaders, quotes, data perhaps that's provided to you by your client to justify the educational program. You want to use neutral language when describing therapies and gaps. So you don't say your supporter's agent was really amazing and then any other competitors weren't so great. You really have to just provide the facts and use the data to support what you're saying. Don't really add any opinion. That's not an opinion piece. And then again, back claims with data references unbiased evidence. And then when it comes to adverse event data, you don't want to go on and on about adverse event data. You want to present these adverse events equally for the different agents, including your sponsor's agent and any other competitors. So that's it for fair balance. Most of it's common sense. It's all about aligning with educational goals.